could see patients all day, every day, and not have to do anything else, I'd be a happy woman. Have you spoken to anyone to try and get some help?
I don't think speaking to anyone will help.
The problem with prostate symptoms in men is that it's quite embarrassing in their eyes to come in for the intimate examination. Would you mind if I examined your prostate today?
I love working here. Every 10 minutes, I can make a difference to someone's life.
I've tried to take my life so many times.
Nothing seems to be curing it, really.
I do smoke a bit of puff.
What do you mean by a bit of puff?
A bit of marijuana.
Your 10:30 is late as well.
OK, I mean, I can see the son now, then, because he was the first appointment.
OK, thank you.
Right.
Gordon Runham. Right, just take a seat. Right, so how can I help?
I don't know how to say it, like, you know when you get dizzy, yeah? But not dizzy, like lightheaded.
Like unsteady? As if you might fall down?
Yeah, like lightheaded, like it's not, not getting enough blood or oxygen to my brain, you know what I mean?
OK, and is your vision straight?
Yeah. It just feels like a bit distant, you know, like, like it feels like I'm going to pass out.
Really?
Like, when I breathe in, it's not... That's when I get it, like, everything becomes a bit tight on the left-hand side of my body.
Oh, right, OK. But it's mainly when you breathe in? OK. Just have a listen to your heart. Deep breath. And out. And out. Good. Just take a seat there. Relax while you're having your blood pressure done, and I'll explain it to you. That's good. So, what happens when people, particularly young patients who are fairly fit, breathe in, the heart rate slows down. And when they breathe out, the heart rate speeds up. And it's called sinus arrhythmia. The amount of blood that each heartbeat pumps out is bigger. Your heart beats less often. Your blood pressure also might fall slightly, and it might give rise to this slightly lightheaded feeling. So your heart rate slows from about 72 when you're resting, and when you breathe in, it slows to 60. Right. And then when you breathe out, it comes back to 72.
Right.
Roughly. But it isn't abnormal. If you don't understand what it is and you become anxious about it, that
makes it worse.
Can be magnified. That's right. That's all it is.
So what's the dizzy? Why do I feel like...
It's because when your heartbeat changes, there's that lag period where it catches up in terms of glucose and oxygen in your blood to your brain.
What about the breathing as well? Is that just a bit me being anxious?
Correct. That's what it is.
Yeah,
so in this situation, it's a normal phenomenon. Our job is to distinguish between something that is important and something that doesn't need any medical intervention and isn't an indication of disease.
Yeah, is that it? Sort of.
That's it.
Cheers, Doc. Thank you very much.
Yeah, nice to see you, yeah. You take care. Bye.
Hold it.
Hello, how are you?
I'm feeling good.
You're feeling good?
Yes.
Why are you here?
You sleep there.
No, I don't tend to sleep there.
He has a bit of a cough. It's been on and off for a few days. Okay. And it's just it's starting to get a bit deeper, a bit more pronounced.
Has he had a fever, do you think?
No, not really. Just a cough.
And what about eating? Is he eating okay?
Not really. It's just less and less.
Has he had chest infections or anything like that before?
Yes, yeah, when he was a lot younger, perhaps 2 or 3.
Do your ears hurt you? Are your ears okay?
Yes, my ear's okay.
Okay.
And my nose and everything.
Everything's okay?
Yeah.
Right, fantastic. Can I just take your temperature? It ticks like a clock, all right? That's fine. I didn't hear it ticking, though, did you? It's all right, though. I haven't got a fever.
What's that?
Just takes your temperature.
Is it my brain? That's my heart.
Your heart's on the other side there, look.
Yeah.
Yeah. Can I just put this on your finger? It doesn't hurt.
Tickles.
It tickles. I'm checking oxygen levels in your body. That looks fine. Thank you. Can I look in your ears? You look very smart today.
That's so tickles.
Can I look in the other one? That's it. Pop your tongue out. That's lovely. Well done.
Do you check my heart?
I'm going to check your heart, if that's okay. Oh, just a bit of a tickle.
Do you hear that?
I can hear your heart, it's fine.
No.
Again. Yeah, he's got a chest infection now. I'm going to tuck your label in, all right? So he needs some antibiotics. Okay.
I got a chest.
You have got a chest infection.
Hello. Sit down, please, lad.
Okay.
Yeah, we can take that.
Thank you, Dad.
So it's going to be 4 times a day, okay?
So do you reckon it'll be a bit advisable just to keep him in today?
Yeah, I'd keep him at home.
Sure.
Have a nice rest today, yeah?
Yeah.
You've got a cough, haven't you?
Bye,
It's lovely to see you, and I hope you feel better soon.
Bye.
Okay, good boy. You've been fantastic.
Thank you
All
very
right,
much.
thank you.
Sorry, just go down.
My
Quick,
name's
pharmacy down here.
Pharmacy's just down there, yeah.
Thank you.
Bye.
Today.
Samantha Holmes. How are you?
I can't take this anxiety anymore.
Go on.
Just this constant feeling of doom and just... My chest feels really tight. And those pills, I was hoping that they would help, but...
What's made things so bad?
There's nothing that's triggered it, it's just... I don't know. It's horrible because I'm constantly feeling like jittery and when you asked before if I had suicidal thoughts and stuff, I said no because I didn't want anyone to think that I'm some nutcase, you know. But I used to self-harm and stuff. Yeah.
Have you done anything recently?
No, I haven't done anything in a while.
So what sort of thoughts are you getting?
Just... I just feel like if I wasn't here alive, things would just go on smoothly and there would be no problems.
How are you doing from the point of view of diabetes?
It's my blood sugar level was high.
And it's high again.
Well, it's funny that.
Diet-wise, are you conscious about what you have, or...?
Cut down on my beer, cut down on bread. I've had no sugar for 9 days on my cereals.
I do cheat every so often and have a sweet. Yes. Do you have alcohol, sir?
As much as I can get down my neck.
If your blood sugar went down...
When you feel a bit wobbly and a bit dizzy...
You would know that you need to get a chocolate bar.
Some jelly babies...
Don't tell me to lose weight, because it's not happening.
I have lost around 9 kg.
Well done you there, you're amazing. I'm really pleased. Richard Baker. Come and take a seat. So, how are you?
I feel a lot better than what I did.
I'm not surprised. Your sugar's very much better.
Oh, good.
So, when I saw you February time, it was up at 113.
Yeah.
Up here.
Yeah.
It's now come back down to 84.
Oh, so it's
So
heading
those
in the right
tablets are
direction.
working?
Yeah, good. Yeah, I lost a little bit of weight when I first went on them.
That's right.
But it's evened out a bit
Oh, right,
since.
okay. So no problems with the waterworks with them?
I've still got the problem of getting up too much at night, but nothing otherwise, I think. Yeah.
Good. Shall we do your weight? Well, just to see what it's doing, don't worry. So take a kilo off for your shoes. So we say 113. Wow, you've lost 5 kilos, so that's about 11 pounds. That's really good.
That's more, yeah. Well,
That's very good.
From scales, yeah.
And you'll be feeling better as well because you've lost the weight.
Yeah.
Okay. I think it will continue to come down, you know. I really do. You do look very much better. Losing a bit of weight at your age, it helps with your joints, helps with your mobility. It just generally makes you feel much better. So.
Yeah. So the only concern I got is getting up so much at night.
How many times are you going in the night?
I get up about an hour and a half after the first time I go to sleep.
And then how many
And
times?
then it gradually extends 2 hours, 2.5 hours.
The prostate warning signs are mainly to do with how you pass urine. Men will notice going to the toilet more often than they normally do. When they go, they're not passing as much as they normally do. Or the stream isn't as strong. They'll also find that they are getting up several times in the night to pass urine.
Would you mind if I examined your prostate today?
No, that's right.
The problem with prostate symptoms in men is that it's quite embarrassing in their eyes to come in for the intimate examination. They don't like to admit that they have a problem. And if we catch prostate cancer early, we can cure it. So I would like to say to all men out there, if you're having symptoms, please come to us.
All right, take a deep breath. That feels smooth, so that's good. Let me just wipe the gel off.
It's a few seconds of embarrassment and then it's over and done with, and we could change your life.
We're all done now. Just get up carefully, don't topple off. Okay, you can sort yourself out. So I'll put the request on the computer for you to have the prostate blood test done, but book that in for a week, 10 days' time.
Yeah.
Is that okay?
Yeah.
As regards your diabetes, we'll see you again in 6 months.
6 months?
Yeah? I'm ever so pleased.
Yeah.
Really, really good. And you look really well, which is great.
Yeah.
Obviously, being up north is good for you as well. Yeah.
Right,
Take
thanks
care
very
of
much.
yourself. Bye-bye.
Bye.
Come through.
That's okay.
So you're...
I'm going to sit there, yeah? Righto.
Okay.
Yeah, I was referred to by Dr. Butt from Weeks Drive
Oh,
surgery.
okay. Fine.
So it's to do with that.
Okay.
I used to suffer from acne, and I've always had like a little thing there. And I was shaving one day, and I must have got some dirt in it, and I never bothered about it.
Yeah.
I just wondered if you could
Yeah,
possibly
I'll-
get rid of them.
I'll see.
Or give
what
me
I can
something.
do. Yeah, okay. So do you mind if I feel around the area? Just
course
see.
you
Does
can.
it cause you any pain at all?
No.
Have you tried squeezing it?
No, I didn't want to.
It looks like there's a keratin plug in there.
Yeah.
And from looking at it on the surface, it looks like something called a comedo, or comedone, basically, is where you can open it. And it's sort of like an open pore. So what I'm going to do to make it more comfortable for you is get you to lie on this couch.
Oh, right.
Yeah.
You can have a go at it, are you?
I'm purposely not going to cause you pain. And if I do, then you must tell me to stop.
No.
All right? Okay, so lie on your back.
Yeah, okay.
And this is more for me to get an idea of.
Yeah.
But occasionally this is...
Yeah.
It can be quite useful to get an idea of what the consistency. So in
Yeah.
that area,
Yeah.
there is sort of a firmness.
I'll tell you if you hurt me, but you carry on.
Can you see that's sort of the area where there's sort of this sort of plug inside the middle? You can sort of squeeze and take these things out, but is that causing you pain?
No, I had an itch. It's all right, carry on.
I had an itch.
Yeah, go on, carry on.
So I'm just trying to see. So this can be, there are different ways, but just trying to see. So you can see there's sort of one of them. Now this is something you can quite safely do at home. Is that causing you pain?
A little bit, but if you can get it out, I'd rather go through the pain and...
Because this might be difficult. So over time...
It's probably better that you're doing it rather than me.
So you can see this sort of keratin consistency coming out.
Okay, yeah.
So you feeling okay?
Yeah, I'm all right.
I haven't done very much. It was more just to see what consistency was in, and you can see that.
Yeah.
But if you kept doing that over time, it will tease itself out.
It'll come out, will it? Okay.
There are some things that I can give you that can sometimes help break down that area.
Yeah.
What I've given you there is a dapaline cream, which
Yeah.
is to be put on at night time.
Okay, fine.
If you find they're becoming very painful and nothing's progressing, then come back
It
to
hurts
us.
a bit now because you've been squeezing it.
Yeah,
That's all right.
I'm really sorry.
Don't worry about it.
Bye-bye. Thanks for talking to Patrick as
That's
well.
all right.
Thank you.
Okay,
Bye.
Anyway, have a nice day.
Bye-bye.
Morning.
Tierney O'Shea, please. Hi there.
Hi.
All right, sorry for the wait. I'm Dr. Tailor.
Hello.
How can I help?
Well, it's coming up to 7 weeks now that Tierney hasn't had a voice. She had a terrible cold, very, very sore throat.
Yeah.
She was given antibiotics because it was on the verge of tonsillitis.
Okay.
Swollen tonsils. And then it went into laryngitis just after that. I brought her back. I was told it would clear.
Mm-hmm.
Still nothing seems to be curing it, really.
Is it still sore? Okay.
The only benefit she says that she has is when she's in lessons, she doesn't have to answer questions.
Shall we have a look? So you're not having any fevers at the moment, otherwise you feel quite well in yourself? Yeah. Just going to have a look at the back of your throat. You know the drill.
Not nice, I know, darling. Bless you.
Can I have a look in your ears as well? Okay. And the other one? Press that into your neck. That's all? No. Okay. Let's just have a quick listen to your back of your chest as well. Do you want to just turn around? Okay. So, your throat doesn't look too bad. Your tonsils aren't up. There's a little bit of redness at the back there. But otherwise it looks okay. And your chest sounds fine as well. So I think you're right. I mean, this classically sounds like laryngitis. Obviously, it's quite prolonged.
Yeah.
To be honest, at the moment, apart from it being laryngitis, I can't really think of anything else that I think would be more worrying that we need to be ruling out here. And in the absence of any pain there or any obvious swelling of the tonsils, it doesn't look like there's any active infection
Right, okay.
there. And I think what we're seeing is the aftermath of the infection that was there
Right, okay.
just over a month ago. The only other thing that potentially we could do is get an ENT doctor, so an ear, nose and throat specialist, to put a camera down the throat and make sure that there's nothing else going on down there. But that would seem a bit mean for something that I'm pretty sure is still just the after effects of a virus.
I understand that.
Yeah.
But obviously this is going on for so long and I want it looked into further to see it, you know.
Yeah. Do we have your correct contact details?
Yeah. Okay.
All right.
That's great, Doctor. Thank
No
you
problem.
so much.
Take care.
Bye-bye.
Bye.
Don't feel so hard on yourself. You've done a great thing by looking after your mum. You are doing a great thing. And what about in terms of supporting you and with everything you have to do?
There's nothing I can say or pinpoint that says, okay, that's what's causing my anxiety or, you know.
It's just everything.
Yeah.
Yeah? Okay. So you're going through a bit of a tough time. But it will get better. If you want it to. You want it to get better?
Well, of course I do.
Okay.
But
So you don't think talking to anyone will help? So I take it you didn't call talking therapies? Okay. So what we're going to do about your medication?
I don't know.
Sometimes there's another medication that we can use, which doesn't really help with what's going on up here in your brain, in your head. but can help with the physical effects. So that actually just calms things down a little bit, so you don't feel so heightened anymore. And we can actually give it in conjunction with the fluoxetine. Do you want to give that a go?
Yeah, I'm willing to try anything at this point.
Will you come back and see me in a few weeks? Yeah. Okay, because I haven't seen you in a long time. You've not touched base. I'm going to ask you again. Got any plans to do anything silly?
No.
Okay. Do you need some more fluoxetine?
No, I'm fine with that.
So I'm going to ask you to take 3 every day, and then I've updated your records for the next time that you ask for one.
Okay.
You can have some more, okay? I want to see you back in a couple of weeks.
Okay.
So don't worry. We're going to be all right. You're going to get through this, and you're going to start feeling better soon.
I've heard that so many times.
Okay, let me rephrase that. If you want to get better and you want to start feeling better, then you will. It's just going to take a bit of time, okay? So keep talking to me.
Okay.
No more going off. All right?
Yeah, thank you very much.
Take care. Antidepressants work for some people and don't work for others. Given the right support, given the right psychotherapy and positive enforcement and encouragement, people can recover.
Yesterday I woke up with my ankle was swelled up in it, and it's very hurting every time I walk.
But you're not registered with this yet?
No, I've only just moved in.
Do you know where Upton Walking Centre is in Slough?
Would you be able to prick me out for a little map?
So, how are you feeling? How are you keeping with regards to your chest?
Yeah, not too bad. It's still alive. I do have a cough, and I do cough loads out, especially if I'm waiting to go to bed and I take my inhalers. Oh, mate, does that clear your chest out?
It's just part of the disease process, COPD. It's just because of damage to the cells in the airways, they do produce more mucus. Keep drinking plenty of water, because if you get dehydrated, it can be quite difficult to bring up because the phlegm dries out.
This don't trust me.
Yeah.
I drink about between 5 and 8 cups of tea, in big mugs, every day, guaranteed.
Good. So how many are you smoking now, Michael?
I've had 3 or 4 so far today, roll-ups. I do smoke a bit of puff still.
What do you mean by a bit of puff?
Bit of marijuana.
Oh, right. What colour's the phlegm normally that you bring up?
Green. How's the breathing though?
Terrible. Tube in mouth, pinch your nose, and then just blow out nice and slow and steady. That's it. Keep going, keep going, keep going, keep going. As much as you can. Squeeze it all out. Good, well done.
Was it? I thought that was rubbish.
What we should probably do is change that nasal spray to something different.
Gunpowder.
Gunpowder, yeah.
Sounds a lot better than last time.
That's probably because I cleared it all last night.
Yes.
Cough, cough, cough.
I've had it so long, I could just put up with it. But no, I do like puff before I go to bed, then I could go into sleep.
That helps you sleep.
Yeah, it's the only thing, yeah.
So relax, blow first. So big breath in, tube in mouth, pinch your nose, and blow out nice and slow and steady.
I can't breathe out my nose anyway.
Oh, right, okay. So keep going, keep going, keep going, keep going, keep going, keep going as much as you can. Good. Right, try and get it right in your mouth. You seem to be pursing it a bit sitting it on the end of your...
I thought I was kissing it.
Yeah.
I know. I'm too much of a gentleman.
Right, go on then. That's good. Keep going, 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 keep going.
Nothing left. They're empty. No more.
No, that's fine. No.
You made my day, thanks.
Okay. So,
Did I pass my MOT?
well, it is a bit worse, I think, than last time, Michael. Your ability to blow out the full volume is the same. It's just your ability to blow out
forcefully that first second. That's gone down. You know, I think the only thing that you can really do is to stop smoking to try and stop this from getting any worse, really.
Yeah. I don't even want to take that vape thing, really.
No.
That's
Have
what I don't
have you done the pulmonary rehab course, Michael?
No? What's that?
It's a 6-week course at Upton Hospital, and then they'll give you lots of different exercises, techniques to cope with your breathlessness.
How long are you in there for each time?
2 to 4 hours, I think. So
2 to 4?
Yeah, I'm not quite sure, but...
Go on then, refer me. OK
Good.
then, Doc. Thanks, Julie.
All right, so keep...
OK.
yeah.
All right,
I'll refer you to pulmonary rehab and, yes.
Rehab, I
Keep-
like that. Thanks
All right, take care, Michael.
Fill me in. How are you?
Well, to be truthful, I couldn't write anything down because it doesn't bother me.
Okay.
The only time
This is the prolapse we're talking about, yeah?
Yes.
Yeah. Yeah?
The only time it bothers me is when I pass water and wipe myself. I can feel it, but not every time.
Louise is one of my patients who is 91. She's a sprightly 91-year-old who has seen me over many years, really, for a prolapse of the uterus. If this were the uterus, that's the body of the uterus or the womb. This is the mouth of the uterus or the cervix from where the smear is done, for example. Occasionally, when the supports are weak, the uterus can actually descend down into the vagina, sometimes to the external opening of the vagina, and can even be seen outside the vagina in very severe cases of prolapse. So let me just recap. You had a ring pessary for the prolapse, and then every time we had a problem, such as a little bit of bleeding because the ring was causing you a problem there, we took it out. The treatment of a prolapse uterus varies depending on the degree of prolapse. So we would send them for physiotherapy. If physiotherapy doesn't help, there is an option of surgery available, but there are some women who actually don't want to have surgery. In that event, we can actually offer a ring pessary to a patient. A ring pessary essentially is like a little bracelet. It's made up of PVC or plastic, and it sits in the vagina, at the top of the vagina, supporting the uterus.
I mean, is there any harm in not having it in?
Not at all. This is why I said to you last time that let's do this exercise where without the ring pessary, you can actually then decide, is this prolapse really bothering me? And you've just said that it actually is not troubling you that much. Put anything in there.
Does it get any worse?
Very good question. So the prolapse can get worse if you get constipated.
I am trying, because I have piles and that causes me a bit.
So are you constipated? Are your stools hard?
No, I'm not. Because I take lactulose.
Perfect.
Yes,
So make sure that you do not get constipated.
Yes.
Take the lactulose regularly because when your stools are soft, you're not straining to pass stools.
Yes.
And when you're not straining, you're not pushing bits of the vagina further down.
No, I
okay?
understand.
Obviously, don't lift heavy weights, but I don't think you're going to be going around lifting heavy weights. And of course, if you had more children, you might.
I don't think I will now.
You don't think you're going to have any children now,
I'd
so
make
that's
history.
yeah, exactly.
What I was going to ask
Yeah.
my sister wants me to go and see her in Canada.
Okay.
And with this,
Yeah.
I'm a bit concerned.
With the prolapse?
Yeah, would it be all right?
Yeah, perfectly. It's not going to bother you on the flight because when you sit down, it doesn't bother you.
No, that's right.
It's not really going to get worse so long as you take all your medications, take your lactulose and make sure you're not constipated.
definitely.
So I can't see that
It's any
being a problem.
Oh, right,
You
I
just need to
wanted to
relax and
ask
have
you
a
that.
good holiday.
Thank you.
Yeah, absolutely.
Thank you very much, Doctor.
It's always a pleasure to see you.
Come on in. How are you getting on?
Oh. Life's just it's just dragging, it's boring,
And the weather doesn't help, does it?
I can't do anything, I just feel trapped in my body, you know what I mean, really do.
You'd recently had your procedure done with the gynaecologist.
Yeah. From the operation, would I get any infection from that, having utensils as such put inside me? I felt a bit uncomfortable and a little bit sore afterwards, and I still feel a little bit twingy now. A little bit,
I think if you had an infection, you'd probably know about it. Often you get sort of quite severe pain or a lot of foul discharge.
No.
So if that's not really happening, it's unlikely.
A little bit,
Yeah.
a little bit sore, a little bit itchy.
Thelma had a hysteroscopy recently, a procedure that a gynecologist would do, where they essentially have a closer look at the inside of the womb and look at the health of the lining of the womb. They use a small camera on the end of a telescope. In Thelma's case, they also did a biopsy, which is where they take a sample of the lining of the womb and send it off to the lab just to make sure there aren't any cancerous changes, for example, in the cells of the womb. And is it itch around the vaginal area?
Yes.
Okay. I mean, one thing we could try, because it sounds like this potentially could be thrush, for example.
Yes.
And that's often what causes itching. I could give you something, a cream and also a pessary to put inside.
Cream and pessary is no good.
No?
I can't exert them.
Right, okay. I can give you a
Because
tablet.
I can't bend. Yeah, a tablet would be fine.
Yeah?
Yeah.
Okay.
There's nothing I can do to get there at all. Bending is out of the question. Because I've just had last year a toilet, and I think I told you, I had a special toilet in my house. For £3,725.
And what's special? And what's
special about it?
So is it
I want you to ask me that. Well,
yeah.
you sit on it, so it washes you, and then as soon as you stop your elbow,
see.
the one. So
Okay.
you stop, it dries you. Little hand comes
That
out.
sounds very high tech.
It's amazing. I love it.
All right. So that's the tablet for the
Lovely. Just stop being comfortable.
yeah. So it's just a one-off tablet. All right. It was nice seeing you again. All right.
Okay. Thank you.
Take care.
God bless.
All right.
Yeah.
You know that clock in the pharmacy?
Yeah.
At Welsh Dragon?
Yeah.
I bought that.
Did you? Oh, it's lovely.
How can I help you today?
I lost my friend about 4 or 5 weeks ago.
Oh.
I haven't been able to sleep since.
Was she a close friend?
My best friend for 35 years. So I can't sleep at night very well. I keep getting bad headaches. My body's all hurting. I've got osteoarthritis anyway, but I think like with the stress, my whole body's hurting. Like some days I can't just walk.
Have you tried some physio for this joint pain? Have you been referred to physio? Looks like it's been going on for many years
No, I've
now.
had this like for about 10 years. There was a stage before they actually found out what was wrong with me. I couldn't walk.
I can see that you were referred to physiotherapy quite a few years ago, and then
Yeah, it's quite a while ago.
2012. Might be worth doing that again.
Okay.
But with regards to your sleep, it's easy to just give you a sleeping tablet, but that's not going to help the situation.
I'm trying to get over it. It's hard because she was part of my life every day.
Do you think you need some counselling? That's something you could probably try. You can self-refer.
I suppose I could, yeah.
So they do bereavement counselling. Shall I give you the contact details of the talking therapies?
Okay.
Yeah, and then you could probably contact them directly because you don't need a doctor's referral.
Okay.
We need to address the primary issue. So counselling might help if you're still struggling. They do bereavement counselling separately. Yeah. So I'll give you the number. And you can self-refer. All right. Take care. Be strong. You've had many good years with your friend.
Very good.
Yeah. So you have a lot of good memories to cherish. And everyone have to go, but it's the way how we deal with the loss, isn't it? It's difficult, but they say time is a healer. Okay, be strong. All right. Okay, Charn, you take care.
Thank you so
yeah,
much.
you're welcome.
Thank you.
Take care. Bye-bye.
Thanks a lot. Bye.
Just give me 1 second. Excuse me, ladies. Hello? Any help out here, please? Thank you.
How can I help you?
Doctor, I've been bleeding.
Okay.
I am so desperate. I need something to help me.
When you say you've been bleeding vaginally? Vaginal
Yeah.
bleeding? Okay. And are you bleeding very heavily then?
Yeah, because I've had 2 different types of medication prescribed.
Okay.
But I think none of them have actually worked for me.
Okay.
I am so desperate. I am dizzy. I am weak.
Okay.
My problem is because I've been bleeding for, it's almost 2 months now.
Yes.
And
you know, I tend to get sore.
Yes.
So I feel like I'm losing so much blood.
Okay.
So that's where my concern is.
That's your worry, is it?
Yeah.
Okay. Well, we did do some blood tests recently, and they were okay. They showed that you weren't anemic. You weren't losing too much blood. Okay. Let me just check your blood pressure today. Make sure that's okay.
But doctor, do you know why I'm so tired, so dizzy, and all that?
That might be to do with the bleeding. It might be the hormones. Okay. Do you have much stress?
Yeah, kind of.
Stress is something that can make people feel very tired. Where is the stress coming from, do you think?
I've been on the medication for a long time. I've been on medication for a very long time. But I stopped it myself because I thought, you know, maybe the medication were not working and I needed to, like, just say to myself, maybe I can do it. But I think sometimes at one point I get discouraged, and I've tried to take my life so many times.
You're getting really anxious.
I get really anxious.
I was in an office, I had to let go. I was a liability on my painkillers. I was not well, I had to let go.
My anxiety's dropped a lot.
You're not feeling as panicky?
Not as bad, no.
Do you have to ask about things like self-harm and, nothing like that?
No, okay. She's got it all under control at the moment.
You've been okay on the higher dose? It's not upset you?
I'm actually laughing.
And coping?
And coping.
It's not as bad as it used to be, but sometimes I really get to that point where I feel like going back to that stage, but I try to put myself together.
Well, even if you don't feel as bad as you used to, and you don't necessarily feel like taking your life, you can still feel tired and down. And
yes,
just because it's not as bad as it was doesn't mean to say it's not causing you to feel quite tired and weary a lot of the time. That's probably the cause of you feeling like that. But we can do some more blood tests just to make sure you haven't got other vitamin deficiencies, other diseases that we've not tested you for. Your blood pressure is actually okay, so you're not losing too much blood to make you faint and dizzy.
Is there nothing else? I am tired of, I'm so sorry to say this, but I'm tired of wearing pads.
So let's go back to the medications that you were prescribed then. How long did you try the tablets?
The first one, they asked me to take it for 7 days, but I took it for more than 7 days because I had to take it because it was still, you know, but at one point, it was working. Okay. At one point, I thought it was going to stop.
Yes.
And then it started again, and then I took the rest of it.
Yes.
So I thought when I finish it, it's going to stop. Then it stopped, and then started again.
Okay. So we could put you back on that one? Would you like to do that?
But this second one hasn't worked at all.
All right. Let's go back then to the one that did work. Okay, so just start taking that every day.
All right. I'm so grateful, Doctor. Thank
all
you.
right. Okay, and keep taking them then until after your appointment.
Okay, thank you.
Okay.
Thank you, Doctor.
All right. Okay, thank you.
No.
No. But
I'm in here. Come and take a seat.
Thank you.
Right, mate, what can I do for you?
I've got a problem. I think I'm getting like some kind of flu or illness. The biggest problem is my throat because I feel quite a big pain when I'm trying to swallow.
How long has it been like that for?
About 8 days now.
8 days?
Yes, I've been taking some tablets, paracetamol recently.
Stand up for me. Open up wide. Dreadful. Yeah, I agree.
Obviously, I just come back from the holiday.
Oh, have you?
I just started feeling really, really bad.
Have a stand up for me again. Just want a quick feel. Are you coughing much or not?
No, not too much now. I just feel the pain when I try to swallow.
Your throat is really swollen, it's really inflamed, and you're developing little bits of pus on the back as well. So you're getting like a tonsillitis, if you want to call it that.
Now, so it's a bit better.
Okay, let's have a quick listen to your back. Okay, deep breath through your mouth. In and out. And one more. Good. Okay, pull that down. Let me just take your temperature. Yep, so you got a high temperature. Your throat looks terrible.
Thank you.
That's the good part.
That's a good part. Okay, what's the bad
Okay, the bad part is we can do something for you. Okay, this always starts as a virus, but sometimes when you start getting all these bits at the back, then we think you may have the bacteria on top. I'm going to give you an antibiotic for that because I think it will help. Yeah. I want you to keep going with lots of fluids. You must drink a lot because you're losing fluid. Yeah, you're losing fluid because you're so hot. Okay, you're sweating and things like that. You can buy all sorts of things over the counter, Difflam, things like that, which is quite good to gargle with because it will help with some of the soreness at the back of the throat. Or you could just take plain paracetamol or something along those lines. Yeah.
I'm all the time taking paracetamol stuff.
I think you may because it will bring down your fever a bit. It helps for a while and then it comes back again. You're not allergic to anything?
No.
No. I want you to take 2 of these tablets 4 times a day, okay, and that will last you for about a week, yeah? And we'll see how you get on.
Can I buy them in the pharmacy over here?
Was it a good holiday, or did it rain all the time?
No, it was quite good. The last 2 days was nice, but as you can see on my face, because I went to sleep on the beach. So
Oh, did you? Very good.
That's why my legs also are so red, you know?
Yeah, another reason why you're hot, mate.
Probably. Thank you very
Try
much,
that.
sir.
Okay.
Okay, have a good day then, yeah?
See you later, bye-bye.
Cheers.
He's a little devil. My cat.
Your cat?
The cat bit me and it came up really high last night. And he catches a lot of rats. It was all puffy through. But it's full of scars with him.
So have you had a tetanus injection lately?
It's been a long time, I think.
Yeah, it is definitely. 2004?
Oh, it was. I think that's when my other cat, I was playing with him, scratched me in the eye.
2004 is when you had the tetanus, yeah. So we can do that today. And some antibiotics there. Yeah?
Okay.
So just give me a second. Yeah, just wait for me there.
Thank you.
I've got Dr. Aaron here to have a look.
Oh, yeah. That's where they always get you.
Yeah.
How old's the cat?
He's 10.
Yeah, and then the teeth carry quite a lot of bugs when they get older. So we need to cover it with what we call a broad-spectrum antibiotic, which is augmentin. Are you allergic to any antibiotics?
No.
Okay, so let's do it now and I can sign it. If the swelling gets worse, if you get any tracking up your arm, we need to know.
Okay. Little devil in here.
All right.
Yeah, and
Take care.
And I'll grab the vaccine.
Okay, thank you.
All right.
Yeah.
Bye.
Devil.
You take care. Okay, you're welcome.
All right, take care.
Bye-bye, Adriana. Nice to see you.
Okay, bye.
See you then.
Fingers crossed.
Yes, very much so.